We all were taken aback when the pandemic hit. We were directionless ourselves, patients even more fearful. They were looking to us for direction, and really none of us knew what to do or how to shape our practice, because we are so used to administering face-to-face point of care. But I think it really held everybody to a great standard, and everybody was called for the moment, and everybody stood to the plate. And I think overnight we turned our practice around to a telemedicine-based practice. California was hit really hard, and we went into lockdown twice. So we quickly shifted to a telemedicine-based practice. All through being in Silicon Valley, we could apply some really cool analytics to it that actually have helped us grow our practice. And then, of course, we were always there for our patients. Patients needed us more than any other time. So we held hands with them. We made sure we got OSHA certified, so we kept our practices safe for them to come back when the lockdown ended. And we kept our operations going the way they were supposed to. And we actually grew about 20% during the pandemic. And we opened 2 offices last year. We opened 2 this year. And our patients have been a huge part of our success story. And without them, of course, we can never move forward. So it's been a win-win all along, except for the pandemic being not such a happy thing worldwide. We are sad about that, but if that was to happen, we still want to make sure that we are there for patients, and that's exactly what we did. We were offering some mental health services through the telehealth before, so it was easy for us to scale it up to all services. When the lockdown started, it was an overnight turnaround in terms of scaling it up to all aspects of the practice. But yes, it is continuing on. We are seeing patients live now. We are OSHA certified and making sure we follow safe practices of social distancing and masking, and we are vaccinated with our booster doses done and so on. But it is reserved for people who are at risk or services that do not require face-to-face interaction. So we still have that as an important aspect of the practice. Right.